Namaskar, I am Dr. Atmaram Pawar. Today we will see the prescription and dispensing of prescription drugs. So medicines have two values. The first is therapeutic effect and secondly it is side effect or safety. So according to the safety, drugs are classified mainly in two categories. These are the prescription drugs and non-prescription drugs. The prescription drugs where doctor diagnose a particular patient and as per the disease condition, as per overall health condition, the drugs what he is taking or the food habits, he write the prescription for that particular patient. But if any other patient having similar symptoms of that disease takes these medicaments, it may be toxic or may show the side effects. So what it indicates? So that the prescription drugs are comparatively less safer, but they are safe if they are written after thorough diagnosis, after a thorough diagnosis for a particular patient. Therefore, such drugs are classified under Schedule H category and it contains about 90% of our drugs, where it carries a warning that drug to be sold by retail on the prescription of registered medical practitioner only. So when the safety of a drug is questioned, then these drugs are classified further as the Schedule H1 category, Schedule HX category, or finally a Schedule X category. In India, now we have many drugs like antibiotics in H1 category because in the past years we used antibiotics very irrationally and it is leading to the development of drug resistance in the bacteria. Therefore, to control the use of antibiotics and to promote the rational use, these antibiotics must be only dispensed against the prescription and the pharmacist has to keep the proper record. Therefore, they are classified under Schedule H1 category. Schedule X category includes many habit-forming drugs, narcotic drugs, which requires thorough control on or strict control on purchase as well as storage and dispensing. So it requires the lock and key system and the prescription should be preserved for 5 years of duration. Many times, simple drugs are also categorized under Schedule X in special circumstances. So for example, during the swine flu epidemic, the Tamiflu is categorized under Schedule X. It is to control irrational use of Tamiflu and to minimize the situation, panic situation that is aroused due to the shortage of Tamiflu. So this is regarding the prescription drugs. The non-prescription drugs are of two types. The first, Schedule G drugs, where the prescription is not required but such medicaments are administered to the patient under direct supervision of that doctor or physician. Now another class is OTC drugs. These drugs are suggested for the common elements like pain, headache, dysentery, diarrhea and many others. So these drugs are suggested by pharmacist by observing the disease condition and proper consultation or counseling with the patient. But this term is actually illegal in our Drug and Cosmetic Act. So today we will see the prescription. So prescription is defined first time in Drug and Cosmetic Act in 1940. And now it is elaborated properly in Pharmacy Practice Regulation 2015. So this prescription have a typical format. And in that format, either the prescription is a written or electronic. And it is a requisite or a direction by registered medical practitioner to the pharmacist to dispense these medicaments but it is not an order. And as per the recent conditions, laws and a recommendation, the prescription should be written in the capital letters. So this is the typical format of a prescription, which includes the parts like first, information regarding the doctor. That mainly includes name of doctor, its degree or qualification, registration number and contact numbers. Information regarding the patient with the identity of the patient, address of the patient, contact number, and more important is its sex, age and body weight. It follows with the date of writing the prescription. Then the super prescription, that is RX, it indicates you take these medicaments. Then it is a diagnosis note in short. Inscription is the main body of the prescription, which gives the information about dosage form, like here tablet. Then the name of drug, either is a branded name or a generic name or both. For example, here Febrex is the branded name of that main drug or generic drug is the paracetamol, and its strength, that tablet Febrex 500 mg or paracetamol tablet 500 mg, it is the strength. It follows with subscription, which indicates the number of units to be dispensed. Either here 9 tablets or 1 bottle or 1 vial, likewise. It follows with the signa, it is a direction to use. In this case, it is 3 times a day for 3 days. It follows with the refill instructions. Whether the prescription is used for further dispensing or not, it is mentioned in the refill instruction. And lastly, it is the signature of that physician or the prescriber, registered medical practitioner. If the prescription is written on the hospital letterhead, then the physician should write his name also, that who is the doctor prescribing from that big hospital. If this is the ideal prescription suggested by Drug and Cosmetic Act, then many times we find such a prescriptions which are difficult to read. So this is too dangerous. One cannot find what is the dosage form, what is the drug and what is the strength. So one should not dispense medicines against such prescriptions, or the government should take action, because this is not a proper prescription what is insisted by law 80 years before. In another case, okay, handwriting is good, but doctor written something more which is a general or very casual. In this case, the patient is suffering from cardiac disease. Actually, such medicaments are required to take over a long period of time till the person's life. But here, doctor written in a Marathi की हे औषध तुम्हाला ईश्वर चरणी जाईपर्यंत घ्यायचं आहे. मीन्स till last day of your life you have to take this medicament. It not looks good to write such things on the prescription. It may create fear or lose confidence or willing power of that patient also. So who is a pharmacist? In a society, it is always considered that the person who can read the prescription is a pharmacist. Really, it is the job of a pharmacist. It is the only job. But in a society, unfortunately, trend is that, or understanding is that, the person who reads the pharmacist, he can open the medical store. Therefore, in India, we find many pharmacies or medical stores are run by non-pharmacy professionals. एक बार ऐसा ही हुआ था, एक जवान डॉक्टर एक पेशेंट के प्यार में पड़ा. उस टाइम व्हाट्सएप वगैरह नहीं था, स्मार्टफोन नहीं थे, तो इसलिए वो लव लेटर लिखता था. बट दैट लेडी नॉट एबल टू रीड दैट लव लेटर्स. तो वो हमेशा वो लव लेटर लेके फार्मासिस्ट के पास जाती थी और फार्मासिस्ट वो लव लेटर पढ़ाते देता था. कई दिनों के बाद, 2 साल के बाद ऐसा हुआ, वो लेडी का और वो फार्मासिस्ट का ही शादी हो गया और वो डॉक्टर चिट्ठियां लिखते बैठने लगा. Apart from a joke, what is my point is the prescription should be written in a good handwriting, capital handwriting, that anybody can read it. And prescription reading is not only job of a pharmacist. In 1940 only, the Drug and Cosmetic Act given different powers and typical functions to the pharmacist that we have to see. The first and most important is sale of medicines only under direct supervision of pharmacists. In India, each and every medicine must be dispensed only by a pharmacist. Second point, the prescription is for single use. If it is not instructed by doctor, if a doctor not write the refill instruction, means that one prescription should be used for single dispensing only. Repetitively, drug should not be dispensed on the same prescription. Endorsement of prescription as supplied or dispensed means प्रिस्क्रिप्शन पे स्टैंप लगाना चाहिए, ठप्पा लगाना चाहिए, डिस्पेंस वर्ड लिख के विथ सिग्नेचर ऑफ दैट pharmacist. Third, refusal of dispensing of prescription. So, the prescription is not an order, it is a requisite of direction. If pharmacist find any error in the prescription, or if that prescription is written by non-qualified doctor or non-registered doctor, then he can reject such a prescriptions. All these points are well elaborated now in Pharmacy Practice Regulation 2015. So why the medicine must be sold under directly supervision of pharmacists? Take an example of Sala medicines, that is sound alike, look alike medicines. The Sala in Hindi, it is the brother of wife. So we have a brother, one brother and wife brother. Both are brother but they are different. Similar things, sound alike, look like drug, looks alike or sound alike. For example, Dulcolax and Duoclox. So tablet Dulcolax is a laxative drug which is taken either 1 or 2 tablets at a bedtime. When there is a constipation, when any patient is too selfish that what he eat, he not leave it. So in such a cases, in a case of constipation, okay, the Dulcolax is given. And Duoclox is an antibiotic which is given in a particular infection fever. Dose may be 2 tablets or 2 to 3 tablets, 3 to 5 days. Means if doctor has written Duoclox and if he get the Dulcolax from pharmacy, then he has to take a leave. Because if he consumes Dulcolax 2 tablets or 3 tablets per day, then there will be a complete laxation. He has to take a leave only. So such things are happen. Take another serious example. Tentrol is a drug which is related to the cardiac problems and Tagratol is a drug which is related to the psychiatric problems. Means if any change is there, then patient will suffer a lot and it may lead to the very serious conditions. Therefore, the pharmacist should check and he should have a knowledge regarding the drug, knowledge regarding the disease and the company and what are the similar looking drugs or similar pronunciation drugs he have. Such thing will happen in August in Mumbai, and this is the news in Indian Express. Doctor written Folimax 5 milligram for 10 days. That Folimax contains folic acid which is used in the anemia. But that pharmacist dispense Folitrax 10 milligram which is anti-cancer drug. See the situation. The folic acid is available usually in a 5 milligram tablet. Rarely it is available as a 10 milligram tablet which is a once day or sustained days tablet, but it is rarely used. Methotrexate is available in 2.5 milligram, 7.5 milligram and 10 milligram. Usually anti-cancer drugs are given or prescribed after thorough diagnosis of cancer condition, after checking the liver efficiency, after checking the kidney efficiency, whether the drug is suitable for not that patient, and usually dose is titrated because these drugs have property to kill or to damage, to harm our healthy cells or healthy body also. These are the toxic drugs. Therefore, usual dose is started with 2.5 milligrams, then 7.5 milligrams, and in very rare cases when the cancer is spread a lot, then 10 milligram drug is given. So again this situation, what is the dispensed is Folitrax for a patient who is just anemic, who is just weak. So we will find what may be happening. First, from the doctor's side, really doctor written this prescription in a capital letter so that anybody can read it. It is the first point is over. It comes to the pharmacist side. The first, whether that pharmacist have the qualified and registered experienced pharmacist in the pharmacy. Correct. So that pharmacist, if it is experienced, if it is qualified, then he can judge the things. Secondly, he should check the prescription, evaluate the prescription properly. Who is a doctor? Real doctor is a general practitioner or doctor is a cancer specialist. Third point, what is the patient condition? Just ask why he needs 10 milligram of such a strong medicament. He has to confirm whether the medicine is delivered to the patient or his representative. He should make a dialogue with that patient or representative who is taking this drug. The third point, if he want to prescribe this anti-cancer drug, really he should take a care and he should counsel the patient properly. Against all this situation, what will happen is, for a simple reason, like a folic acid, that patient taken that Folitrax anti-cancer drug and the patient finally is no more and the punishment is there given to the pharmacist. Again the case may be going on, it is not in a detail, I am having this information. But it indicates the importance of a pharmacist in a drug dispensing. So therefore, the assessment of prescription is most important. The first, prescription should be checked for its legal validity. Whether the prescription is written on that prescription format or letterhead of the hospital, with identity of a doctor, with the qualification of doctor and with registration number. It must be there. Second point, the prescription includes appropriate dosage form and appropriate route of administration. So it includes the dosage form, whether it is tablet, capsule, suppository, what it may be, then the name of drug and route of administration to be taken. एक बार ऐसा ही हुआ था, one patient having the constipation, और वो दवाई लेता था. He was very happy that the laxation was over and his stomach get cleared. But he was having one point. He came to the pharmacist and complained that the pharmacist भाई जो टैबलेट है ना वो बहुत स्टिकी है और अच्छी swallow नहीं होती और वो बहुत बहुत बिटर भी है. वो फार्मासिस्ट बोला दिखाओ क्या लेते हैं, तो देखा तो डुलकोलेक्स सपोजिटरी थी. सपोजिटरी इज टू बी एडमिनिस्टर्ड बाय रेक्टल रूट और ये सांप मुंह से लेते थे, which is a soft type of dosage form and which is a bitter. So this should be clear, which is the dosage form and which is the drug, what is the route of administration. The prescription is appropriate to the patient condition or not. So for example, many times in the heart problems, sublingual tablet is given and that tablet should be kept below tongue. But if the patient have a psychiatric problem, even depression, then usually symptom is dry mouth. There is no saliva. And in such a cases, that sublingual tablet is difficult to disintegrate and dissolve below the tongue and drug will not get reach in the blood circulation. So the intention is good to give the sublingual tablet, but if the condition of patient is that the dry mouth condition is there. Duration of treatment. Take an example of anti-worm products like albendazole, which is used to expulsion of worms. So usually one tablet is required generally to expel the worm. But many times we find the prescription for 28 days or 1 month. It indicates that infection is rooted. That is, that worms are entered in the blood circulation or even in a spinal cord or a brain. In such a cases, the drug treatment is longer. So, same drug may be given for different reasons also. So, the pharmacist should check that the treatment or pattern of that drug. The prescription is appropriate according to the patient parameter. Mainly age and the weight, they decide the dose of drug. In addition to that, what previous medicament that patient is taking is also important, because there is chance that the previously some doctor have prescribed some antibiotics. Again, if the new doctor prescribes antibiotics, then it may lead to the critical condition like resistance of development in the bacteria and no effect or side effect of that medicaments. There are many such examples. Therefore, the history of that patient should be checked for what medicines he or she takes. The prescription is compatible with other medicaments or not, it should be confirmed. The possibility of side effect, the possibility of adverse effect should be checked by the pharmacist. It is only possible if the pharmacist is there in a medical store. Drugs are contraindicated. Take example. Many drugs are contraindicated in the pregnant woman, in the lactating woman. So, actually, such a condition should be written on the prescription that this lady is pregnant or lady is feeding the milk to the kid. So, in such a cases, the pharmacist can take a care regarding whether the medicament is dispensed or not to dispense. The potential for misuse or inappropriate use of medicines. Sometimes some drugs are purchased in a bigger quantity. It may be not used for therapeutic use or medicinal use, but for some habit forming use or some for addiction purpose. So if any patient takes the particular drug regularly or in a larger quantities, it indicates that it is not for that medicinal use. The prescription should be compliant with the labeling requirements. The delivery of the prescription, whether the medicines are collected by a patient or his representative. It is a good point if the medicines are collected by a directly patient. Here it gives a chance to a pharmacist to make a counseling, to check the understanding of the patient and to avoid the misdispensing of the medicaments. So it is the good thing. Otherwise, if the representative is there, then we have to tell all the information and he should communicate the same information to the patient, which is find difficult many times. Refill of instruction. This is the most important line in the prescription, but if we see 90% of the prescriptions doesn't carry these refill instructions. Drug and Cosmetic Act 1940 mentions that the prescription must not be dispensed more than one unless it is stated by that registered medical practitioners. So it indicates that he should write the refill instruction, that is refill 1, refill 2, PNR or NR. What it indicates, we'll see with the example. Suppose that pregnant woman needs the calcium and iron for total 9 months of period. In such cases, if the doctor's intention is to write this iron and ferrous tablet for 3 months, then that lady will visit and he will write the another medicament. If he directly write this calcium tablet, ferrous tablet for 3 months, and if that lady purchase all these medicaments, then it increases chances of misuse of that drug as well as there may be a storage problem. In such cases, doctor can write medicines for 1 month and he can write refill twice. So that lady will purchase 1 month medicament and after that 2nd month and 3rd month medicament. So this is called as a refill instruction, refill 1, refill 2 likewise. PNR. In a certain situations is that it is not need that the patient should revisit the doctor. The problem is not too much critical. In such cases, doctor recommend the pharmacist to continue the treatment. For example, any painkiller is given for 2 days. In such cases, doctor can write TNR. It indicates that after 2 days, the pharmacist should judge the situation of that patient, and if required, he can dispense this medicament for 1 or 2 days. So here, the responsibility is given to the pharmacist by the request of that medical registered pharmacist that you take a decision to continue the prescription for 1 or 2 days, what is the prescribed there. NR, the prescription should not be redispensed. Take an example of sleeping pills. Particular doctor writing one sleeping pill. Then it indicates that okay, you have to take only one sleeping pill and don't repeat it. So if we follow this, then there will be less misuse of medicaments. And these things are supported with the endorsement. So after first dispensing, if there is a stamp like a dispense and sign, means this prescription will not be valid. If there is a refill 2, then second stamp should be there, refill 3, third stamp should be there. In the case of NR, if there is a stamp, that is that one tablet sleeping pill is dispensed by the pharmacist, now that prescription not remains valid. Otherwise, any person can show this prescription in number of medical stores and can collect 100 of sleeping pills, and it is happening in the society. So what is important is the refill instructions and endorsement. And I am proud to say these